When it comes to things like prescription medication and dental services, cutbacks have been the order of the day for many years. Chiefs Rhonda Kirby and Zachery-Deom recently attended a national conference on non-insured health benefits. The conference was called to create a strategy to deal with the cutbacks and other problems with these services that First Nations people depend on. With the annual Assembly of First Nations General Assembly coming up, there was a clear sense of the urgency among the participants who came from across Canada to discuss the matters at hand.
So over the years, we've seen cutbacks in several areas, mainly for dental and the different types of medication.
Cutbacks. It seems to be cutbacks ought to be the name of the Conservative government, because that's what they've done. They've made deals, and in those deals, the provinces have absorbed certain transfers for health, and then cutbacks have arrived as a result. In Quebec, we're still fairly lucky.
So across the country, there are issues a lot different from what we see here. In remote areas, you know, people are driving for 6 hours to a city, and when they get there, they find out that the medication or treatment hasn't been pre-approved, so they're being denied.
So there was that issue. But when you come to talk about Kahnawake and access, we have fairly good access. We're 11 minutes from downtown Montreal. But for us, there's a different issue. For us, it's the issue of where services are to be provided. For us, because we're on the South Shore, they've been trying for a number of years to keep us involved with only South Shore. So you go to Anna LaBerge first, but if you've got a doctor already at, let's say, the Jewish General, then that sometimes is being a problem, but it was addressed, and it ought not to be a situation.
I think the initial goal was really to start looking and having all of the community stand together to look at a national commission that would really look at the issue of the non-insured benefits.
I will point out that work is being done on non-insured health benefits. We have here a guide to procedures for accessing health services. It tells you how to appeal. For instance, how to appeal when your child has orthodontic problems, and they say, oh, it's cosmetic, you're not going to get that, you have to pay for it yourself. Well, the people who made the presentation from the Quebec region were saying that there are standard appeal forms. Some have a little bit of a blurb that has to be filled in by the orthodontist, and then how these are sent on. And there's a third appeal. There's all kinds of appeal measures. And if you just keep knocking on the door, the presenter said, you will get your way. Another issue that was raised at this conference, which was really quite good given all of the national issues, is the issue of traditional medicines and how they're going to be incorporated into regular medicine, how it's going to pair up with regular medicine.
You know, there was representatives who talked about all of the issues from each province, and a rep from out west talked about that they spent a lot of money to get him there to this workshop conference, and he wanted to go home with something. So they changed the format on the second day to include what could be done tomorrow, next week, and in the next couple of months. But they are planning to have another national meeting in the beginning of June, but by then to really look at some of the issues. So they're going to compile all of the recommendations from the group that met and send it out to everybody, so that they have a working document that will be ready to have some groundwork done anyway before the meeting in June or July.